So it's my pleasure to introduce you today to our presentation and our two presenters. So we have Linda Young and Christina Nidra. So Linda develops her knowledge and expertise with breastfeeding while she taught obstetrics at the University of Toronto, Faculty of Nursing, and then as a clinical nurse specialist at Women's College, where she focused on enhancing breastfeeding and family-centered care. As a CNS, Linda developed a breastfeeding protocol, provided education for staff, students, and physicians, provided consultations for postpartum NICU and family practice patients with breastfeeding problems, conducted research-based evaluations, and developed the two-day U of T breastfeeding resource nurse course, which she taught for 5 years. While working as a director at Centenary Health Center, she developed one of the first breastfeeding clinics in Scarborough. Linda has worked in director roles in hospitals across the GTA for over 20 years. She is currently the director of maternal newborn child mental health, interprofessional practice, and organizational learning at Toronto East General Hospital, role that she's been in for the past 5 years. And during this time, Toronto East General Hospital has become redesignated as a baby-friendly hospital. Linda is also the lead for the BFI Strategy for Ontario. Linda is joined by Christina Nidra, who completed an NA in Public Policy and Administration at Ryerson in 2011. Since then, she's worked in various roles at Toronto East General Hospital, including leading hospital-wide accreditation, implementing multi-program IT change management initiatives, and coordinating a City of Toronto system-level implementation project. Christina has been working as the project manager for the BFI Strategy for Ontario since December 2013. She has coached dozens of organizations in baby-friendly implementation and has co-facilitated over 30 BFI implementation workshops across Ontario. So it's our pleasure to have Linda Young and Christina Nidra joining us today from BFI Strategy for Ontario. Thank you, ladies.
Thank you so much for that introduction. It's Linda speaking first. And welcome to our webinar on baby steps, implementing the baby-friendly initiative best practices. We are very happy to be sharing our work with you. I want to point out before we start that General, although we are leading this initiative, we are doing so in partnership with the Provincial Council for Maternal Child Health and the Best Start Resource Center at Health Nexus. We are also partnering with BFI Ontario and the Breastfeeding Committee for Canada in the work that we are doing to ensure that our teaching is well aligned to the designation process. So I'm going to go on to the next slide, and our goals for today were to provide an introduction to the baby-friendly initiative, to share with you some of the strategies and practical tips that we've developed for promoting BFI best practices in your role as best practice champions, and to describe some of the tools that will support you on your BFI implementation journey. Highlights the origins of the baby-friendly initiative, and it was many years ago that this work started. You can see that practice change takes a long time, because the first thing that happened was in 1980 when the World Health Organization had a code on the marketing of breast milk substitutes and issued that for across the world consideration. Subsequent to that, about 10 years later, the Innocenti Declaration on the Protection, Promotion, and Support of Breastfeeding call to action was issued. And together, these were used to establish the baby-friendly strategy by the World Health Organization in partnership with UNICEF to ensure that all maternity centers actually became centers of breastfeeding support. All countries across the world were challenged to come up with a BFI supporting strategy, and so the Breastfeeding Committee for Canada was struck to lead that work in Canada and to become the body that actually accredits organizations to become BFI designated. I will say that the Inocenti Declaration, a summary of that, the 2005 edition, is actually on the Breastfeeding Committee for Canada website, and would encourage you to look at that if you want more information on that and on the World Health Organization Code. So the code itself, as I said, was developed in 1980-81, and it provides a global public health strategy for ensuring that breastfeeding is supported and protected. In particular, it was developed to reduce the impact of commercial marketing on mothers, healthcare workers, and healthcare systems, and really focuses on the use of breast milk substitutes, bottles, and teats. So, for instance, one of the huge practices that was rampant in the early 80s or in the mid-80s was the giving of free formula to women during their pregnancy, before they left the hospital, and the messaging to women was, don't worry, feed your baby formula, you'll be fine. And so lots of women were feeding formula initially, and that interferes with the successful uptake of breastfeeding in the first few days. There's also labeling of breast milk substitutes and unethical marketing, and so the code really addressed those issues. So this slide shows you that together, when you take the World Health Organization 10 Steps to Successful Breastfeeding and the WHO UNICEF International Code of Marketing of Breast Milk Substitutes, together these provide for us best practice standards and policies to ensure successful initiation and duration of breastfeeding. They also protect breastfeeding by ensuring that industry marketing of breast milk substitutes meets ethical standards. So why would you want to become baby-friendly? And I would like to point out that our initiative is actually funded by the Ministry of Health of Ontario as a strategy to support the development of practices that ensure that women who want to breastfeed are successful. And the impetus for this came out of the Healthy Kids Panel report that was actually issued a few years ago, and it cited three major bodies of research as the groundwork for recommending that more work be done with supporting breastfeeding. First of all, there are decades of research that ensure that we understand the value of exclusive breastfeeding, and that it has an impact not only on infant development, but also on maternal health and infant health. There's also a body of research that talks about the value of actually implementing the steps to BFI, and it shows that hospitals that have implemented 6 or 7 of the 10 steps actually have significant differences in their breastfeeding rates to those hospitals that are not on the BFI journey. And then the third thing is that the research clearly underlines the value of ongoing healthcare provider support for breastfeeding success and underlines the need for consistency of practitioners in the community, both before the woman comes into the hospital and after the baby is born, and those practitioners that follow newborns even after midwifery practices have transferred them at 6 weeks are significant in terms of whether or not the woman continues breastfeeding and exclusive breastfeeding to the recommended 6 months, and whether or not women breastfeed beyond that. So at first we were focusing on the benefits of breastfeeding, and now we are moving to discussions about the costs of not breastfeeding and in some cases the risks of formula feeding literature. And the key issues are that there are increased risks for infants and children in relation to allergies and a number of health problems, intelligence, diabetes, obesity, etc. There are issues for mothers, increased risks for 2 kinds of cancer, and when we look at the family unit, there are increased costs of formula feeding, and on top of that, the increased time lost from work or the stress associated with that when bottle-fed infants have a higher incidence of respiratory and gastro infection. And then lastly, the increased exposure through use of the healthcare system, either for physician appointments, emergency visits, and hospitalizations for children, are actually impacting negatively the healthcare system. So as we move forward, the 10 steps to becoming baby-friendly are outlined on your screen. This is a real skinny on those 10 steps. A number of years ago, the Breastfeeding Committee for Canada made the decision to go to an integrated model of 10 steps, building on that whole essence of having continuity in terms of support, right from preconception through post-hospitalization and up to 2 years of age. The guiding principles of the BFI are important for us to be aware of. First of all, it's inclusive of all infants regardless of how they're fed. It focuses on evidence-based and best practice, which the best practice champions are all about. It focuses on informed decision-making, not practitioners pushing their own values around breastfeeding as the only way to feed. I need to say it's really important that we recognize that there are some women for whom breastfeeding is not the appropriate way to feed. And this can be either physiologically they can't feed via breast, or psychologically it is not a good fit for their values and how they feel about themselves. And in fact, as a clinical nurse specialist, I did come upon situations in which women were just totally distraught trying to breastfeed. And when you look at that situation and you watch the woman, you have to look at the level of communication that's happening. And it's very negative communication with that baby. And the communication is largely nonverbal. But when we think of the importance of effective parent-infant bonding right from the start, it further underlines the need for informed decision-making as opposed to putting our personal values out there. 2 other guiding principles are that the BFI supports breastfeeding across the continuum of care through ensuring consistency and collaboration. And so in our own initiative, we are doing a lot of work about building networks within local communities for that full continuum of care to ensure that there's consistency in messaging. And then the last thing is that BFI empowers and encourages public participation in terms of skin-to-skin, being comfortable breastfeeding in different places, women going back to work and still being comfortable breastfeeding. This work with BFI has some key impacts on the patient experience if you're thinking about clients in your care, whether it's in the hospital or in the community. We end up with more holistic care if we're working with families and ensuring family integration. We end up with a healthier mother and baby and healthier relationships. We, from that, actually have higher rates of patient satisfaction. The BFI also builds collaborative care and integration along the continuum that I've talked about, and as a result, we are in the process of trying to build healthier communities across the province. This slide is, in a nutshell, the work that we're doing for the ministry. So more than 2 years ago, the ministry made a commitment, or 3 commitments, towards supporting women who wish to breastfeed in the province at a higher level of service and quality. And the commitment that we have is providing hospitals and community health organizations with training, tools, guidance, and resources to help achieve the World Health Organization's BFI designation and to adopt the best practices that meet BFI requirements. This work is funded by the ministry, as I mentioned, along with 2 other initiatives that are being led by other organizations. So one of those is through telehealth, and they now have 24-hour access to breastfeeding support through telehealth. So if you didn't know that, it's really important that you share that among your clients and colleagues. And the second one was funding to Best Start Ontario, and Best Start is actually focused on assisting with the improvement of breastfeeding rates among hard-to-reach populations or populations with lower breastfeeding rates. And they do that through community funding and community projects that have some criteria and accountability, and going forward, we're hoping that that will continue in beyond March 31st of this year. The strategy our strategy is actually focused initially on those organizations in the turquoise panel there. So we're focused on hospitals, community health centers, Aboriginal health access centers, NP-led clinics, family health teams, and birthing centers. Within that, we figure this is somewhere around 360 organizations. There are, of late, midwifery practices are becoming really interested in this initiative, so we are including them now in our work. And before we started, the public health units across the province had been mandated to become BFI designated. So they are the real leaders in this work, and we often partner very effectively with them in bringing communities along with improving breastfeeding rates. Our goals are threefold: to increase the number of organizations pursuing BFI, increase the number of organizations who are achieving BFI, and to ensure a TQI strategy for sustainability of designation. This slide shows you the baby-friendly facilities in Ontario. Although the BFI initiative has been around for a number of years, we at this point only have 4 hospitals that are designated, and our congratulations actually go out to Grey Bruce Health Services, who became designated this fall. And then there are 2 community health centers in Ottawa that are designated, and to date there are 17 public health units across the province. And this slide actually shows you those public health units that have been successful in obtaining BFI designation. So the expected impact of our work is identified here, and this is how we're monitoring our success. It should have an increased rate of the initiation of breastfeeding. We should have an increased rate of exclusive breastfeeding at discharge from hospital. We should have a decreased non-medical supplementation in hospital, an increased duration of breastfeeding beyond 6 months, and an increased number of organizations with BFI designation. Ultimately, these changes will ensure a positive impact on the health of infants and mothers in Ontario. So Christina is now going to talk to you a bit about promoting best practices in your role as best practice champions.
Thank you, Linda. So there are a variety of ways to promote baby-friendly best practices within your role. And in this next portion of the presentation, we will look at the different approaches that you can take and some practical tips to support you. One way to conceptualize the various ways to support BFI best practices is by looking at 3 paths. One path is to pursue baby-friendly designation, but there are also other paths to supporting the best practices. These include implementing baby-friendly best practices in whatever setting you might work in, or an alternate path of supporting a baby-friendly continuum of care. I'll walk us through each of these paths, identifying how you can support the BFI depending on which path is most suitable for you. If you are working within an organization that is eligible for baby-friendly designation, then pursuing BFI designation is really the ideal path. As Linda discussed, we know the benefits of the baby-friendly initiative, and these are most effectively realized with implementation of the complete program and with the oversight of the Breastfeeding Committee for Canada assessment process. So this slide highlights the 5 key milestones to designation that are outlined by the Breastfeeding Committee for Canada. The full overview of the designation process and all of the associated costs for these steps can be found on their website. But at a high level, I'll just go over these. The first step is to develop a facility multidisciplinary breastfeeding committee. And this committee should be representative of the various roles, areas, and departments of your organization, because it will act as the anchor or foundation for the organizational-wide implementation. So there really needs to be diversity within this group. Next, you'll see the facility capacity building visit. This is optional, and there are costs associated, but it really can happen anytime within the journey. And the facility capacity building visit means is that an assessor would come on site and have a look around, speak with staff, and help you through any opportunities for improvement and provide some guidance. When you are confident that the practice outcome indicator criteria are in place at your organization and you have confirmed this in a self-assessment, you can already move to a pre-assessment. And this comprises 2 distinct portions. So you have your document review and your pre-assessment site visit. For the document review, you would be submitting key documents to the assessors. For example, patient education materials, brochures, documentation of education of healthcare providers within your facility, a review of your website. And at this point, assessors are essentially ensuring that you're ready for the next steps. And they, again, would provide recommendations for improvement before you move to the pre-assessment site visit. And the pre-assessment site visit is essentially an abbreviated but comprehensive external assessment where an assessor would come on site, speak with staff, physicians, volunteers, again, do a bit of an environmental scan to identify opportunities, and they provide feedback once again. Once assessors feel that the organization is ready, you would be moving to an external assessment site visit. So the external assessment site visit can last up to 3 days, may involve 3 to 4 assessors. It's a very comprehensive visit. The assessors speak with mothers and families that come through your organizations. They look at documentation, chart audits, and if you are able to demonstrate that you have met 80% of the criteria, you will be successfully BFI designated. And if there are still opportunities for improvement in terms of not reaching the criteria, you will get a certificate of commitment at that point. You do need to go through the reassessment process, starting with the pre-assessment document review every 5 years. Becoming baby-friendly designated is a very complex change, largely because of the underlying beliefs and values of individuals around breastfeeding, as Linda spoke to. It is therefore important to be very deliberate as you undertake this journey and ideally utilize a change management approach. Here we want to highlight some tips that we've heard from designated sites that might be helpful to you, especially if you're getting started in this journey. So number 1, be open to new ideas. Utilize this implementation as a learning experience, both for yourself and for your organization. Ask questions and be curious. So have dialogue as you move through the process, collecting ideas, letting people express themselves and any concerns they might have with the process. Stay positive. It's important to anticipate roadblocks and not to get discouraged. You want to celebrate small successes, and this speaks to the value of having a work plan to help you along your journey so that you can celebrate as you tackle different activities on your work plan as you move through the process. You want to learn from each other and from things that do not go well. Learn the art of respectful dialogue and reframing. And this is where you can utilize tools such as the RNAO Self-Reflection Guide to reframe and talk through some values issues, perhaps, and have dialogue on those questions. And let go of old ideas, especially if you are struggling with them. So if you're getting stuck, try something new and try to be creative in your approach. And if you are able to meet all those criteria, you could be the next Owen Sound Hospital. So here again, we're really celebrating the fact that Grey Bruce Health Services was recently successfully designated. And we know that at least 28 hospitals in Ontario have successfully received a certificate of intent, meaning that they have done some of the preliminary work in their BFI designation journey, including setting up that multidisciplinary committee. So it goes to show that it really is possible to become baby-friendly designated, even within a climate of time and resource constraints. So if your organization cannot pursue formal designation at this time, the alternative path then is to look at best practice implementation related to the Baby Friendly Initiative. So this is where you can look at the BFI practice outcome indicators and reflect where it might make sense for your organization to start different pieces of this work. You might want to bundle some of these best practices with existing programs or work you are undertaking. For example, if you're in primary care and you're working on a quality improvement project, look at some of these and perhaps position one of the steps within your work. For example, step 10, transition from hospital to community, really fits well with quality improvement. And for hospital, written breastfeeding policy fits in well with accreditation and preparing for accreditation. So as best practice champions for breastfeeding, if your organization cannot pursue formal BFI designation, this really might be your ideal path. And as Linda mentioned, in organizations where only 6 or 7 of the steps have been implemented, there are improvements noted. So it's starting from what makes sense to you and pursuing the implementation. When speaking of the best practices, we like to share a story from Sioux Lookout Meadow Yawin Health Center. And if you've been to our implementation workshop, you may have already heard it, but it really is a lovely story. Meadow Yawin Health Center is a small rural hospital in northwestern Ontario that serves a massive geographic area. As you can see from that slide, a number of rural communities are served by that hospital, and they have around 500 births per year. Sue Anderson, the director of their maternal program, shared that before the hospital had determined that they would pursue formal BFI designation, they received a letter from a patient that set out some of the opportunities that she had identified regarding her birthing experience at the hospital. And one of the opportunities that she identified was the fact that she was not able to do skin-to-skin following a C-section. Sue utilized the letter and feedback as an opportunity for improvement and reached out to the patient to co-create a process that reflected best practices and the Baby Friendly Initiative, and therefore will have a larger positive impact on the health of infants and mothers in their community. This letter was the catalyst for the implementation of the best practices. So the key message here is really to look for windows of opportunity, start where it makes sense for the implementation. If your organization is not suited to pursue formal BFI designation, or perhaps not in a position to implement the best practices because of the types of services that you provide, for those times that you do interface with families, at the very least, there are opportunities to support some of the baby-friendly best practices along the continuum of care. So first, it's important to have consistent evidence-based patient teaching materials. It is helpful to know what is being given out to families in your community by both public health, hospital, and primary care so that all partners are sharing consistent messages. For the most part, we've noticed that public health units in Ontario are giving out Breastfeeding Matters to families. It's a comprehensive, evidence-based tool for families that is available for free download from the Best Start Resource Center in 16 languages. In addition, I've included a snapshot of the reference sheet magnet that shows the size of the baby's stomach over the first few days and weeks. Again, this magnet is available in 16 languages from the Best Start Resource Center. In addition to providing it's critical that healthcare providers across the continuum of care know where to send mothers for breastfeeding support in their community. Two supports to be aware of are the Bilingual Ontario Online Breastfeeding Directory at ontariobreastfeeds.ca, where healthcare professionals and families can search for local breastfeeding support, including breastfeeding clinics, peer support programs, La Leche leagues, etc. There is also 24-hour, 7-day-a-week breastfeeding support through Telehealth Ontario. Mothers should call the main telehealth number and indicate that they are calling about a breastfeeding issue so that they can be put through to a specially trained RN. We know that telephone support cannot replace in-person counseling on breastfeeding issues. However, Telehealth Ontario is an excellent support for mothers during hours when other supports may not be available and to help point families to community resources. This may, in turn, avoid unnecessary trips to the emergency department for families and unnecessary supplementation when the family is perhaps experiencing a bit of a crisis in the middle of the night. So Telehealth Ontario can help with some troubleshooting, at least until they can reach in-person support in the morning.
So I'm going to talk a little bit more about tools that we've developed to support BFI implementation at your organization. And the next slide gives you an overview of really our trajectory. So what we have already prepared are two toolkits. We heard very clearly when we were planning our work that a number of organizations really had difficulty understanding the implementation process for becoming BFI designated. And so the first toolkit is an implementation toolkit, and we accompany the toolkit with a 3-day workshop. We've held the workshops, as Christina said, all over the province, and she's been involved in a number of the implementation workshops. And the workshops are free. We do them for 2 people from every organization. And as I said, people get the toolkits. And subsequent to that, we developed the 20-hour course toolkit. And this gives people the slides and the teaching notes and the workbook to teach the 20-hour course for those who want to teach it in person. So, and the course is actually developed into 4 4-hour modules with the assumption that the last 4 hours would be in clinical practice, either in an observational or a co-practice model at a clinic or a site that has women who are breastfeeding. Those workshops have been implemented more recently, largely this fall, and so we are still doing them for all over the province. If you are interested in a workshop, I would suggest you talk to the BFI leads in your organization and see if they can recommend and contact us to get you registered for a workshop. The next thing we did was translated Breastfeeding Matters, which was developed by the staff at Best Start Resource Center, into 18 languages. So they already had initially the 1-page summary of the amount of milk that a baby needs in the first week and some other best practice messages in 18 languages, and so we matched that with the Breastfeeding Matters. This is a book on breastfeeding for women. It has tips in it, how to breastfeed, that kind of thing. And 2 of those languages, I would note, are Aboriginal languages. That resource is free, downloadable off the Best Start Resource Center. And then we also created a site visit strategy for hospitals. So for the 3 designated hospitals, and now we have to bring Owen Sound into the fold, we have a slide presentation. It's the same no matter where you go. We have a tool for planning your site visits, so we make sure that you get the best from the resources that are there, and we focus on your areas of learning, and then an evaluation tool. We also have done a lot of work with Foreign Ontario to establish sound reports for hospitals in terms of the BFI indicators, and I'll talk to you a bit more about that in a minute. And then we have a Baby Friendly 101 e-learning module, and we created this from work that East General had done as a refresher course for our physicians and staff prior to designation. It works really well as an introductory course and as a refresher. So if you're just starting out on your BFI journey and you can get a member of staff or even your multidisciplinary team to do that e-learning module, you will find that you then have a shared perspective on where you need to go. Coming soon, we expect to launch within, I would say, the next 4 to 6 weeks, an early preterm infant booklet and a late preterm infant booklet. These will be launched in English and French initially, and over the next few months, our intention is to translate them into the same 18 languages. We also have BFI Clearinghouse, which is in the final stages of testing through a soft launch, and it will be available in January. This will house all of our resources and any resources externally that we've reviewed that are fully compliant with BFI, so that people don't have to review a number of things, and you can start your journey with tools already created. And then the last thing is we have a booklet on infant formula, what you need to know, and this is being reviewed by external reviewers beyond Ontario so that we can get a really good perspective, because we're still debating the best way to present a few key ideas. That will be launched probably the end of January, February for sure. Our last thing is what we have under development. So we are working on a virtual site visit for community agencies because we realize travel and that kind of thing may not be as easy for everybody to go to Ottawa. Secondly, we're working on data collection strategy for community organizations. Many community organizations are on electronic medical records, so we are going to work on documentation tools and report tools that then can pull the data that match the indicators they're responsible for. And then finally, we're working, as I mentioned, we will work on the translation of the new patient education materials. So the other thing I didn't mention that I'll just mention quickly is that we're running webinars, 2 sets of webinars, one for those who've attended the implementation workshop, and this is on a monthly basis. It allows coaching and peer support and peer sharing of ideas. We're addressing key things that where there's some debate and unfamiliarity with the literature to try and be an impetus to change. And that's available to anyone across the province. So in terms of facilitating the change, we have done work with Born Ontario. We have 2 new reports that are on the Born website. One is a modification to a report that was there before, and the second one allows hospitals to compare their data with their peer group in terms of volume, their peer group in terms of level of maternal newborn care within hospitals within their LHIN, and then with the province. So there's 4 benchmarks attached to that tool. The tool also allows people to drill down to the actual charts that have contributed to the data when you're looking at particular indicators. The indicators that are being pulled are the ones that I told you are our expected outcomes. And so that way we're ensuring that there's no debate over the definition of what your indicators are. And for hospitals, they're very easy to print out at any time. The second thing is engaging peers and leadership. So it's important for you to learn about BFI, the investment in health for your community, to talk about that, partner with other organizations to build your full continuum of care, and to get some peer support and ideas when you feel like you're trying to address some kind of roadblock, and be realistic in your goals. So one of the things, there are 10 steps to becoming baby friendly. And we tend to say to people, if you tackle 2 steps a year, that gives you 6 months to work on it, and that should give you a good CQI cycle where you can design your work, implement it, evaluate it, and refine it. within that 6-month period. And then finally, in terms of educating, looking at both online and in-person education. For non-direct care providers, there is a free online tool on the Best Start website. So if you have housekeepers or secretaries, clerks, that kind of thing, there is a tool there to help familiarize them with BFI and what their role may be, how they might support it. And at the end of both that one and the electronic tool that I told you about that East General has created, you can print a certificate and show your boss that that's been completed. So it's easy for tracking. And then the third thing that we should mention here is, of course, the RNAO has their online course. And my understanding is that Owen Sound Hospital made really good use of that in terms of preparing people for their journey. The education piece that you need to keep in mind is not only do they want you to track that you've provided education to your providers, but they also, for BFI designation, test people's knowledge through questioning. And that's done through the preliminary site visit and then the designation site visit. And they ask anybody on 3 shifts about how they approach specific problems, how they, what they teach mothers, where the challenges are for new mothers, and really focus on people's ability to apply and integrate that knowledge. The last thing is often education is a challenge from the cost perspective, and we recommend that you work with your administration to be creative and plan some of your education over 2 years. So if you do training February, March, and then April, May, you actually could do it 1 module in 1 year and 1 module in another year and still manage the budget effectively. The next slide shows you a bit about where we want to go in terms of the tools that I talked to you about. And the bottom graph there shows you where people are in terms of reaching the 75% level, and each one of those lines represents a hospital across Ontario. So you can see lots of us are below the red line, and that's where the work is to be done. And then the next one shows you our dashboard that we are monitoring births across the province. You can see that from born, we're able to really monitor a fairly substantial amount. The last column is only till September year to date, so that would be April till September. But it shows that incrementally we're making very small gains, but in the right direction across the province. The born data is only for the first 5 indicators. The last one there is based on a community survey, and once we have our community process in place, we'll be able to fill that one out. So in terms of facilitating the change, some key tips to keep in mind: use the resources on the Best Start website and in the clearinghouse. Attend an implementation workshop as a representative from your organization. Attend the Hot Topics webinars. Reach out to ask questions or to access coaching support. And we have a microsite. It's on your screen now. And that microsite, you can ask coaching questions. You can get access to anything that we're doing. And we also, through that, advertise new things that we've implemented. So as we had in the title, it's all about baby steps. Implementing baby-friendly is actually a culture change, and the research shows culture change often takes from 5 to 10 years to really embed something. I can tell you that East General, the first time we got designated, to the second time we got designated, had a huge level of improvement in terms of how embedded BFI was in our practices. So it takes a long time. You must be patient, but you also don't get caught up in roadblocks. Just look for a different direction to go in. And as Christina said previously, remember that there is more than one path. You may be on a path to designation. You may be on a path to focus implementing best practices in your unit or in your health center. So we would be pleased to entertain any questions.
It's Catherine here at RNAO. So thank you, Linda and Christina, for your excellent presentation and the wonderful work that you're doing through BFI Strategy for Ontario. Yes, we now have some time for some questions. So please use the chat box. If you use the send to all participants option, then we'll be able to review those questions. And maybe just while we're waiting, so someone's asked, when would the 2 webinars be scheduled?
That's a great question. So you can have a look at our microsite. I'll bring up that slide again so you can write it down to see when each of the webinars are taking place. Our next webinar is actually happening this coming Monday, and it will be on educational needs around BFI designation, and our presenter will be Kathy Venter, BFI assessor. So again, have a look at our microsite that's listed on your screen, and you'll get details there on upcoming webinars and how to register for them.
Great, thank you. Another question, how do women access the telehealth support for breastfeeding?
So women access telehealth support by calling the main telehealth number. The recommendation is that they right away let the person picking up the phone or the operator know that it is a breastfeeding issue, because then they'll be brought into a special line with specially trained nurses to facilitate the call. Otherwise, the risk would be that they'd have to repeat their story a number of times until they reach that support. So they call the regular line and just indicate right away that they are seeking support on a breastfeeding concern or issue.
Thank you. Another question, do you have access to how small hospitals are implementing decanting into their hospitals? The webinar done by TGH pertains to more large organizations.
That's a great question. I'm going to perhaps park that one because decanting, as you know, is a huge issue, and we could probably spend a whole webinar on it, but it's helpful to know that perhaps the webinar that we did not address the small hospital questions around decanting. So I'll take that back to our team and we'll look at a follow-up, perhaps tip sheet or webinar. In the meantime, do get in touch with our coaching team. We do one-on-one coaching with organizations, and then we can really talk about what your specific circumstances are, whether it's a small hospital, rural hospital, what are your different challenges, and we can strategize with you.
Thank you. Thanks, Stacey, for that question. Shelley asks, is the Toolkit for BFI 20-hour course available for purchase outside of Ontario?
Yes, it is. Again, I would say if somebody from outside Ontario wants to purchase it, if they send an email in through the email site that Christina has on there, the www.tgh.on.ca/BFI Strategy. There is a direct email in there, and just send us the query and we'll get you the information on the cost, and let us know how many you want, and we'll sort that out from there.
Thanks, Linda. Another question, I think this one is for you, Linda. What to do when a baby is admitted to the NICU, mom can't breastfeed from baby perspective other than pumping? What else do you suggest that women do in this situation?
We make sure that the women do a fair amount of skin-to-skin through that time. When the mom is pumping, we ensure that she does certain things that help. So one of the things that Toolkits does is gives moms a face cloth to stick in their bra during the day, and then when that baby is in their isolette, they put the cloth in with the baby. So the baby is imprinting on the mother's smell, and also if it's been around the breast, there might be some milk leaking. So again, it's that building that familiarity and that nonverbal connection so that when the baby is ready to breastfeed, the baby already has a well-established relationship with the mother, and with cuddling and with positioning so that breastfeeding initiation goes a lot smoother.
Wonderful. Another question is regarding the webinar, the upcoming webinar that you're having on Monday. Will that be recorded? Is there a way then that participants can hear the recording at a later time?
Yes, absolutely. All of our Hot Topic webinars are recorded, and you can view the archives on our microsite.
Wonderful. Is PIV a recommended way?
Is what?
Person's room, PIV, a recommended way.
I'm not sure what PIV stands for.
Okay, I'm sorry, nor do I. Perhaps I can ask the individual who's written that question just to rewrite it or just write out what the acronym stands for. Someone's asked, is the PowerPoint presentation used today available? And yes, we can share that with you. And again, it will be archived as well. Another question, are the 4-hour clinical practice for breastfeeding only available for ones who work in the clinical area? Are there options for RNs who want to transition into maternal child or NICU or labor and delivery or birthing suite?
So we haven't really established anything in that regard yet. One of the things, we're in the process of finding out whether or not we'll get funded for another 3 years. If we get funding beyond the end of March, we are looking at not direct hands-on stuff, but more video clips to help substitute for some of that clinical practice, because there are a number of people in the province, in northern communities and other places where they won't get quite the same exposure. So we're looking at how technologically and otherwise we can develop some tools to support that. So once that becomes available, if we are funded, I would say it would be available through our microsite, as Christine has said, and so anybody who's interested in furthering their knowledge could access that.
Wonderful, and certainly we're hopeful that you will be successful with that ongoing funding. So the clarification about is PIV a recommended way, so peripheral IV fluid used instead of formula being ordered for the baby. Again, I think that's a question for Linda.
So I think instead of formula, I think that depends on, I mean, I don't think that BFI makes a statement on that or has a comment. I think that that's something that needs to be worked out within each institution with your physicians, et cetera. And I think it would depend on the patient and the situation. Whether you're going to put in an IV just when you could give one formula feed, or it's simply a small supplement versus an ongoing situation. So I would recommend that places who are looking at that, you really need to work with your neonatologist, because I'm assuming you have a special care nursery, and your physician pediatric group. I will say that if we get funded in the next year, we will also have an initiative that supports physician knowledge development in terms of education for BFI, and that may help organizations where there are differences of opinion and knowledge levels among different professionals.
Wonderful. Again, we're hopeful that you're able to have the funding to be able to do the work and continue the promotion of breastfeeding as you are. So we are almost out of time, and I think we've answered all the questions that I see posted. So again, I want to thank Linda and Christina for their wisdom and their time today and sharing the good work that they are doing. Again, we will be forwarding to everyone that's attended our webinar today an online survey. We ask you just for some feedback regarding today's presentation, and if you have any further ideas regarding any other topics that you'd like to see us cover. Once you've completed the evaluation, then you'll receive a certificate of attendance. We certainly will, with that email to you, send the links for our breastfeeding guideline here at RNAO, as well as our online learning course, and we'll ensure that you receive that information. Next month, for our Best Practice Champions webinar presentation, we'll switch gears a little bit, and on January the 28th from 2 to 3, have a presentation on our falls guideline, so it's prevention of falls and fall injuries in the older adult, and we have Kathleen Waller from the Vision Nursing Home in Sarnia. She'll be speaking to us about the implementation of that guideline. So you can see the email addresses on the screen for Linda and for Christina if you're needing to get in contact with them. Again, we thank them both for their time today and for all of you for attending our webinar. So I wish you a good day. Thanks.